Good morning, everybody, and welcome to our open house for the PA program. We're really excited to have you here, and we hope that you learn a lot today and get some of your questions answered. I'm Dr. Kimberly Dempsey. I'm the program director, and I'm going to let the rest of our team introduce themselves right now.
Hi, I'm Shannon Morris, and I'm one of the admissions co-directors for the program.
Hi, Jane Penny, and I am the other half of Shannon's brain as the other admissions co-director for the program.
Hi, my name is Erin Suit. I am the office coordinator for the program, and I assist both Professor Morris and Professor Penny in the admissions process. I did want to take this brief moment to remind you that this session is being recorded, and it will be distributed on the website as well as in emails. And the chat will also be recorded.
Hi everybody, my name is Elizabeth Fabian. I am a third-year PA student, which means I'm out on my clinical rotations right now, and I'll be graduating in May.
And hi everybody, my name is Amanda Myrick. I am finishing up just about in a week my first year of PA school, and I'm in my didactic year, and I'm really excited to be here today.
All right, thank you guys. So Erin has a poll that she's going to put up. I can see we have at least 115 people attending and a bunch of people still joining. So we can't, unfortunately, be there with you and meet and greet all of you in person, but we would like to know a little bit about you. So we have a couple of polls just so you can kind of tell us where you're coming from and who you are. So we want to know who's logging in from the farthest away. I know she's working on that now. So you probably know that we are in Norfolk, Virginia, in the middle of Hampton Road. So we'll watch this poll and seeing a lot of people that are local. Also seeing someone outside the U.S. And a pretty good mix. Anybody here that didn't answer the poll want to go ahead? Gifty, do you have a question? You can stick it in the chat. Welcome from Connecticut. 10 more. Okay, well, it looks like we have a good amount of people in Virginia. Sorry, Kim?
If you don't see the poll, I was going to say, if you don't see the poll, you might need to click on the little poll icon down at the bottom.
Yep, so right at the bottom, you'll see a bunch of icons. The one to the very right that looks like a graph. If you haven't had a chance to respond, you can go ahead. But we're excited to see somebody outside the U.S., maybe military, maybe not.
Hello from Germany, nice. I see there's a Georgia here, New Jersey, Ohio, California, wow.
Welcome, it's early over there, isn't it? I used to live in Germany. Well, thank you for joining us from so far away. Great. All right, so Erin's going to be popping up a second poll, and there we want to tell you where you are, and we want to know where you are in your educational journey. So we put anywhere from middle school to career changer. If you have something that fits outside of that, feel free to chat us and let us know where you are. Moving to Norfolk in a few months. Welcome to the area.
Delaware, New York.
All right, here we go again. So middle school, high school, college, grad school, and career changers. I do expect to see a lot of career changers. We know you guys are out there trying to get your healthcare hours, right? And college, middle school. Amazing, that's amazing. I wish I had known about this profession in middle school. That's very cool. Good for you guys. What middle school, if you don't mind typing in the chat?
Never too early to start looking.
Completed grad school, that's great.
And you're coming back for more. You were determined. Welcome.
Nice. I would love to know what middle school. So if someone is in middle school and is local, please let us know so we can make sure we reach out to that school and get more like you. Well, great.
From building cars, that's neat. I know a lot of, I had some attendings in internal medicine who were big about car repair. They said it was actually really similar to the brain and the heart.
At the VA hospital, Hampton VA? That's cool. From politics to medicine. I love politics. You're probably tired of it, but I don't love it right now, but I love it in general. I love the spirit of it. Okay. Well, thank you guys for sharing some things about yourself that makes us feel a bit more connected to you. So I am pulling up, and if you are not Kim Dempsey, you can go ahead and turn off your camera so we can see her well.
All right, so we're going to do a little presentation right now to tell you a little bit about the profession and a little bit about our program before we start showing you some of the website and then answering some questions. So I'm going to give you a little presentation. Hopefully everybody can see this well. So what is a physician assistant, or PA is what we're commonly called? The official definition of a physician assistant is that they are healthcare professionals. So they work in the healthcare field taking care of patients on a daily basis. They are nationally certified and state licensed. So our certification is on a national level. And the certification is what allows you to practice in the healthcare field. So after you graduate from an accredited PA program, you will have to sit for your certification examination. And this is a 5-hour exam that you get to go to a testing center and take, and it tests you on all aspects of medicine, heavily focused on the primary care areas, but it is focused on all of medicine. Our national certification allows us to practice in any field, whether it's general medicine, general pediatrics, emergency medicine, or a specialty. You just need one certification to do that. We are licensed by the states. So when you start to practice, whatever state that you are a resident of, you will have to obtain a license in that state or where you're going to be practicing. Some PAs, especially in this area, we're so close to North Carolina, some PAs will have 2 state licensures that they maintain for their practice. But that is typically just filling out a form and providing some documentation that you are certified and that you're keeping up with your CMEs when you go to renew your licenses. So we do practice medicine with physician collaboration. Now, the laws used to say physician supervision, but they're changing all over the country to a collaboration, and that's more reflective of the team-based healthcare that we provide with not only physicians, but with nurses, physical therapists, radiologists, you name it, all members of the healthcare team. So our practice is done in collaboration with physicians. We consult with them when we need help with patients, but we're not supervised at that level any longer. So what do PAs do in the clinic? Well, they pretty much do anything that you will see nurse practitioners and physicians doing. We perform physical exams. We are in the clinics. We do well checks. We do acute care visits. We do chronic care visits, any type of physical exam. We order and interpret lab tests. So if a patient needs to have blood work done or they need to have some type of a study done, such as an MRI, CT scan, ultrasound, we will order those lab tests and interpret them. Our program actually teaches ultrasound, so not only will you interpret ultrasounds, but you could be doing ultrasound in the clinic. You can perform surgical procedures. So in-office surgical procedures, some of the specialties, physician assistants will do that. I used to work in dermatology and would do in-office procedures. In the OR, we can be first assist, but we cannot be the lead surgeon. That is for the physician. They monitor and manage hospital inpatients. So we have several graduates, and there are several PAs that work on a hospitalist group. So that's all they see and treat are hospital-based patients, but PAs will also consult, They'll see patients in the ER. They might work for, say, an oncology group, and they'll round on the patients that their group have in the hospital. So we do work in the hospitals as well as the outpatient clinics. And then they prescribe medication and educate patients. So we have prescriptive privileges. We can prescribe the medications that the patients need, and we provide a lot of patient education. And that's one of the really big things that we focus on, is educating that patient so that they understand how their disease works, how they can take care of themselves, and how best to avoid chronic diseases. So like I alluded to earlier, PAs work in all specialties. Where you find physician specialties, you will also find PAs in those specialties. This is a graph that shows some of the more popular specialties with PAs, and this is recent as of 2019-2020 survey that they send out to all the certified PAs. And as you can see, the surgical subspecialties and family medicine and general practice are the two highest specialties. And then right under that is emergency medicine, internal medicine subspecialties, and general internal medicine. And then dermatology, that's my specialty, yay, hospital medicine, general surgery, pediatrics, and psychiatry. Now, psychiatry is one that is kind of rising at this time because there's a lot of need in psychiatry, and we have more and more students from our program and then other programs also that are going into that specialty. You'll notice that the specialties that tend to be at the top of that list are very technical type of specialties. PAs are trained to do a lot of procedures, so it's not surprising that they would tend to gravitate towards those procedure-based specialties like the surgical specialties, emergency medicine, and the like. So the PA job outlook is good right now. During COVID, PAs have been on the front lines of COVID. We've had many of our graduates that unfortunately were working in practices that had to close down because it wasn't essential medicines, but they were able to go to places and work on the front lines of COVID. We had several graduates that were in the middle of the pandemic in New York City. So PAs work everywhere, and we've been essential workers for fighting COVID also. If you look at job satisfaction, all the surveys out there show that PAs have a great job satisfaction. As you can see from this statistic here, 84.1% of PAs would choose their career over again. You'd be hard-pressed to find any other medical specialty where you have that high of a job satisfaction. Our graduate survey also reflects that high job satisfaction. Our graduate survey usually comes out with higher numbers than that. So PAs like what they're doing. So if you want to find out a little bit more about the PA profession, the PA education, or some of the big burning issues that are going on now in the PA profession, these are 4 organizations where you can start your research. So I'll start with our national organization, the American Academy of Physician Assistants, AAPA. You can just Google these, they'll take you right to their website, but that's our national organization where you can see what's going on at a national level with our profession. We have the Virginia Academy of PAs up there, VAPA is what we call it, but every state has their own PA organization. So if you're not in Virginia, look up your state PA organization. NCCPA is the national certification body for PAs. So this is the organization that administers the certification exam. That certification exam is called the PANCE, P-A-N-C-E, and it stands for Physician Assistant National Certification Examination. So if you want to find out more about the exam, you can get on the NCCPA website and find out more about that. And then PAEA, last but not least, is the Physician Assistant Education Association. So most, if not all, of the PA schools in the United States are members of PAEA, and they provide resources to the programs, but they also provide resources for people who are looking at PA programs or in PA programs. So I encourage you to go to the PAEA website also to find out information. So a little bit about our program. We talked about it in general. Our program is a 28-month program. The first 16 months is the didactic portion. You're sitting in the classroom, you're listening to lectures, although right now the lectures are online and you're not sitting in the classroom. However, we still have our labs on campus. That we have labs where you learn those techniques that I was talking about earlier. And we also have standardized patients where you learn how to practice your history and physical exam. Now some of that's being done virtually through the computer screen, just like we're meeting this morning, but some of it is also still being done face-to-face in our lab. So the first 16 months, sitting in the classroom, listening to lectures, going to labs, taking exams, all that fun stuff. And then the last 12 months are rotations. You spend about a year in clinical rotations in all the different specialties of medicine. Our classes start in January. We are one of only less than a dozen programs that start in January. We do that at EVMS because that allows our students better access to the cadaver lab. You're not competing with medical students in the cadaver lab. The degree that we award is the Master of Physician Assistant degree, MPA. So our didactic phase, a little bit more about that. It is 4 semesters. It's straight through. You have breaks between the semesters, but you don't have summers off. We have a summer semester. And this is just a sampling of what you will be learning. In the first semester, we do have the anatomy cadaver lab. This is a dissection lab. This year we have a new course director for anatomy. It's really going to be exciting. She used to be the program director for the contemporary human anatomy program here at EVMS. So she's got a lot of great resources. We'll be teaching. You'll be in the students who are starting in January will be in the cadaver lab and dissecting the cadavers. We have pathophysiology. We have a 3-semester pharmacology course that we've expanded to 3 semesters. It used to be 2 semesters, but now it matches the clinical medicine course. We also teach you, obviously, the history and the physical exam, since that's a really big part of being a PA. You have a 3-semester clinical medicine course that includes surgical topics. We have a clinical skills course. We call it medical diagnostics. But you learn how to read EKGs and x-rays, how to suture, how to splint, and how to perform ultrasound, along with a lot of other procedures. We teach clinical reasoning. That's actually part of our history and physical exam course, and that teaches you how to deal with all the data that you're getting from your history and your physical exam when trying to treat your patients and diagnose them. Patient counseling and education is a standalone course. We feel very strongly that educating our patients is a very important part of our job so that they can maintain their health. And then we teach evidence-based medicine, which is very important because it is what girds what we're doing in the clinic. Then the clinical phase, you get about 2,000 hours of clinical experience. We have 9 clinical rotations. They are each 5 weeks. The required rotations are internal medicine, pediatrics, family medicine, general surgery, emergency medicine, women's health, behavioral health, and then you get 2 electives. You can repeat one of the core rotations if you like, or you can do a specialty rotation. We have people who'll do a specialty surgery like CT surgery, or they might want to do a dermatology rotation, or they might want to do a pediatric urgent care rotation. There are lots of different electives that you can do. While you're going through the clinical phase, we give you a practice PANTS exam. That's the practice certification exam. And you have end of rotation exams after all of the core rotations. So that would be 7 end of rotation exams. And they are all PANTS-like questions because we are preparing you for not only the type of question that you'll be answering on that certification exam, but the depth of the material that you'll be answering. Throughout the clinical year, you will have a PANCE review course that you participate in, and that also has questions that you can take, practice tests, and prepare yourself for the PANCE exam. And this is integrated in our senior seminar course, so every so often during the clinical year, students will come back for some lectures and things like a CV writing or mock interviews. This is all done during our senior seminar course that goes through the clinical year. So what you should be concerned about when you're looking at PA programs is their PANCE pass rate, because you don't want to go through a program and then not be able to pass the certification exam, because like I said earlier, if you don't pass the certification exam, you can't practice. So we have really good PANCE pass rates. We are typically at or above the national average. This year's data, you'll notice, is not up there because we had some late graduations due to COVID. We have one person that is still left to take the PANCE examination in the middle of this month. However, we are sitting at 97% for this year. The national data will not be available until after January. Last year, there was a new certification exam that came out. They let us know in March that the certification exam had changed, and as you can tell, even the national rate last year was a little lower than it has been. But we are back up at 97%, and we're really happy this year. All right, I'm going to turn it over to your admissions team.
Hello there. So I have a few brief slides about admissions, and then I'm going to hand it over to my co-director, Jane, so that she can take you into the website and we can get onto the admissions guidebook and show you how to get your own information as you're preparing to apply. So first of all, just a brief slide on our minimum eligibility requirements. So this is what you need just to be able to have us actually take your application and take a look at it. So a completed CASPA application, and you can find the link to that on our website and in the guidebook. U.S. citizenship or a green card, a minimum qualifying GPA of 3.0, 8 completed prerequisites, which we talk about a lot in the guidebook, so we can certainly delve into that more if you guys are interested in that. A completed bachelor's degree and a CASPA test, which tells us more about who you are and what your personality is like. So like I said, we have a page, 1 to 2 pages in the guidebook about prerequisite courses. There's a lot of detail, but this is just a brief summary of the 8 prerequisites. You can see that some of them have time limits. They all must be 3 semester credit hours, and you must complete each course in the United States by March 1st with a minimum grade of a B-. So those are some of the most important things to think about early on. Know that it's a competitive process to get really into any PA program. These are details for our particular program, and these are ballpark numbers because this really depends on each cohort and the pool of applicants that we're dealing with in each cycle. So for the last cycle, we received about 1,400 CASPA applications. Now, not all of those are going to meet the minimum requirements that I showed you on that first slide, so some of them just don't get accepted at all from that point. Of those 1,400, though, the ones that do meet the minimum eligibility requirements, we start reviewing those based on how competitive they are. So we're looking at the GPA and your past academic performance, and then we're reviewing the application, looking for healthcare experience and volunteerism and all the different things that are important to our program. And so we review as many as possible, and the faculty are doing this throughout the year. Then we send out invitations for interviews. And the amount of invitations we have to send out is again dependent on who accepts our interview offers. So this the past cycle that I have data for, we sent about 300 interview invites to fill 160 interview seats. And then from there, it's kind of a 50-50 shot. And I'll tell you that our faculty would love to take most of all 160 of the people that we interview. So if you made it to that point, then you're a very competitive applicant, and it doesn't mean that necessarily that you didn't interview well. It just means we have a cohort of 80 and we have to make those decisions. So I encourage you, if you got to any of these points, to just keep trying and keep reapplying and trying to improve your application. So other than just knowing the minimum eligibility requirements, it's important to know what our average matriculant looks like so that you can prepare to be competitive. So my co-director, Jane, is going to show you on the website where you can find this up-to-date statistical information. But this is what I have that's most recent. So for academics, our qualifying and prerequisite GPAs are generally falling above a 3.8. We also have a section of the guidebook that talks about GPAs, and we're happy to go into that. We'll give you an opportunity to let us know if you want to talk about that more. For work experiences, our average applicant has 2 or more years of direct patient care experience or a combination of patient care and healthcare experience, and we can also talk about that more in depth. Volunteer experiences, our applicants are highly involved in the community. Our average applicant has 800 volunteer hours, and this is in line with our mission at EVMS to be the most community-oriented school of medicine and health professions in the country. So this is what we're looking for. We're looking for applicants that are strong academically, have experiences, and volunteer in their community. So if you're looking and you're ready to apply, then you might be really interested in what the deadline is. So for the cycle that's open now, that opened on July 1st, the deadline is March 1st of 2021, so coming up pretty quickly. And that class will matriculate the following January in 2022, and it's always like that. All right, so before we move on, if you do not have a Pearl already, so some of you might know what this is, but if you don't have a Pearl, go ahead and pull out your phone if you have it and hold your camera up to this QR code. You'll be taken to, and you can also just visit go.evms.edu if you don't have your phone. This will take you to an inquiry form, and when you fill that out, you'll get your own personalized URL, which we call a Pearl. You can see that in the chat. So you'll hear us refer to a Pearl a lot throughout this presentation, and if you contact us in the future. The Pearl is your own personal website. It has information about the program. It's where you get updates about the program, and it's where you can ask questions. So you'll be connected directly with an admissions representative through your Pearl. So if you have a question that you can't find on the website, then just feel free to click it into that I have a question section, and one of us will get back to you. So maybe even Erin, Rose in the admissions department, or one of the admissions co-directors. So that's a way for you to keep in touch with us, even if your question doesn't get answered today, because I see there's a lot going on in the chat, and I know we won't get to it all. So maybe a pop quiz later. Remember your Pearl. All right, I am going to unshare this and allow Jane to go ahead and take you guys to the website. And I'll try to answer some of these questions in the chat.
So actually, regarding the questions, I think we can answer some of them, but a lot of those will have the potential to be answered coming up soon based on a poll that we'll show you in just a little bit. So guys, I love your enthusiasm. I want everyone to hear all of the answers to the questions that they have. So as many as we can get to, just keep an eye out for that poll. If you could hold your questions until then, we'll be sure to get to as many as possible. So in terms of where to find some more information about our program and admissions to our program, we encourage you guys to go to the website. Here's our website for the PA program at EVMS. We have an admissions page, and so if you access the admissions page, you can explore a lot of the information that we typically share when we have questions about admissions. And a key thing to look at is the admissions statistics, and then also the admissions guidebook. So we'll start with the statistics because we have a different way to share the guidebook. These statistics are published out there for everybody to see. You can see our cohort makeup and the trends over the last several years. And then you can see the average GPA and kind of where the benchmark is in terms of where applicants have set it. Keep in mind, these are not our cut points. These are the averages of people who have applied. So you guys are so smart and so talented, and you really do bring a lot to the program. So keep in mind that these are the averages of the applicants that you're kind of applying against. So as you're evaluating the competitiveness of your application, pay attention to those. These are the places that we go to when we're looking at, well, how is their patient care experience looking compared to the rest of the people who are applying? How does their GPA look compared to that as well? And how does their volunteer experience look compared to the rest of the bunch who are applying? So that is the statistics, and then I will share the admissions guidebook, and this is meant to be a super amazing resource for you all in terms of what you need to do in order to apply to the program. And so it's 16 pages. It used to be much longer, and we decided that was a little too long for comfort, and so we narrowed it down for you guys from like 45 or 50 pages to 16. We're hoping that that makes it more accessible and useful to you. And so to get through and show you kind of the beginning piece of this, and keep in mind, guys, if you need to blow this up on your screen, you can do that by looking at the little magnifying glass on the left top corner of your screen. There are some instructions for that before, but in case anyone's forgotten, you can zoom in using the little plus sign. So this guidebook is meant to be a pretty definitive guide for all of the necessary things you need in order to apply to the program. We use it in conjunction with the frequently asked questions on our website and our website itself, which we just walked through. I showed you the high points of the things that apply most to the application process. And we do make some changes every now and again. We try not to change things mid-cycle as much as possible. I'm sure with life the way it's been the last year, you guys have been rolling with some changes and the punches of a pandemic on your own. So if anything comes up, we do have a COVID page and we'll post changes there. Make sure you're checking it to be sure that you're staying up to date with the admissions requirements for the year. In terms of admissions consultations, you're looking at the bulk of the team for the PA program. And we love what we do, and we're very excited to do it. And there are 128 of you in here. We're not sure we're going to answer all of your questions, and there are about 1,500 people that apply. So that we get to look at an initial review of their applications each year, and so that's a lot. It's a lot of people, and we can't always meet with people. So our preferred method of communication, because we do want to communicate with you, we want to be able to connect with you, is through email and through your Pearl, as Professor Morris mentioned, as Shanna mentioned. So make sure you're looking at the information that's available to you online. We're trying to make this an easy and accessible process for you, so that you don't have to ask us questions. But if you do, please email us through your Pearl and let us know. Doing that helps us keep track of what we've told you, and it helps us keep track of interest in the program, and it also helps you because it keeps all of your application information for EVMS in just one spot, so you don't have to go hunting around for it in other places. In terms of timeline, I know that there was a timeline question out there, and so here's some of the answers for that. This is the general review process and timeline. So our application cycle for CASPA opens in July, and then most of our application is due by the next March. By March 1st, you have to have your CASPA application complete, your CASPER test completed. This is a situational judgment test that kind of lets us look at some of the non-cognitive aspects of the of applicants and how that will fit as a student and as a PA provider. All your prerequisites need to be completed, and a TOEFL for applicants with foreign education is required, especially if you have English as a second language. So applications are reviewed by the SHP Office of Admissions between September and May, and then the PA program takes some application reviews at the next level, at the next step between January and May. Interview offers are made by June. You have to have your bachelor's degree and any transcripts for prerequisites, not the courses themselves, just the transcripts submitted by July 1. Interviews are in July. Offers of admission are extended in August. You have 10 days after we send the offer to respond if you're given one. And then matriculation is January, and for this cycle, graduation would be May of 2024. All right, so that's the general timeline. It's not rolling admissions. It is a review at a specific time. And these are kind of the general high points of where we want you to submit materials. So I'm going to turn it back over to Shannon for our poll.
All right, I'm back. Okay, so before we move further through the guidebook, we'd really like to know what areas, we saw some questions in the chat, so we'd like to know what areas that you'd really like to talk about the most, and there's a lot of you, so we probably can't please everyone, but what we're going to do is a poll, and we're going to include 4 hot topics, so areas where we get a lot of questions through the Pearl or by email, and so we'll make those suggestions to you, so feel free to choose those, one of those 4 choices. If you don't see something that you're really interested in hearing about, if it's very specific to you, you might want to go the route of asking us through the Pearl. If it's a big topic that the rest of the group might benefit from, then go ahead and stick it in the chat, and Erin will try to look for some common themes as we go through the rest of these. Keep in mind the last 30 to 45 minutes or so today, we're hoping to reserve that for Q&A with our students, Amanda and Elizabeth. So there might be questions that are a little more relevant to the end of the session today. So go ahead and vote if you have not. I'm seeing a lot of healthcare experience, and I was on here last night brushing up on how to talk about that. And we're going to try to include information about related to COVID in each of these because we know that's on everyone's mind. Thank you, Ebony. I'm glad this is helpful. Hopefully it'll get even more helpful when we get into the stuff you guys really want to see. So I'm going to take a quick note on what we're going to talk about first. And it looks like healthcare experience has the most votes, and then prerequisites is another popular one. And if we get to it, we'll talk about GPAs and then Casper. And then if anything else pops up that you guys are seeing in the chat, then we will get to that as well. All right, Erin, that looks good. So let me pull out that guidebook again. And for healthcare experience, I'm going to share page 10 with you guys. So you know where to find this on the website now. And again, if you need to blow up, you can use that little icon, the purple up at the top left, and make it bigger or smaller or fit to your screen. So I'm going to be talking about healthcare experience. And so we get a lot of questions about this even without the pandemic. Everyone wants to know what counts and what doesn't count. And now people are having a hard time finding experiences. So what I would say about that is we have never had and we don't have a minimum for healthcare experience. It's desirable and rewarded, and we certainly want you guys out there trying to get as much as you can. But it's all going to come down to how you compare to the applicant pool. And Jane kind of mentioned that when she was looking at admission statistics, that those are the people that apply, and we don't know who's going to apply. So we won't know, and we won't have those updated statistics up until the end of the following cycle. So in January, we'll be posting our matriculants for the class of 2023. So we're always going to be a little bit behind. So again, just do what you can and look for experiences and keep plugging away at those. We do have questions about how experiences are categorized by our review committee because they will categorize them as either healthcare, volunteer, or patient care experience. So it's important to tell us what duties you're doing in each position. So really be descriptive about that. And if there are duties that you're doing that have to do with direct patient care, and I'll talk about what direct patient care means, make sure that you include that in your CASPA application and make it very clear to the reviewer that you're providing direct patient care, because we're looking much less at the title of each position than we are at what you tell us you're doing. If you're looking to apply this cycle, don't feel like you need to wait until March 1st to do so. If you have an experience that's active and you don't put an end date on it, we're going to go ahead and extrapolate those hours out until March 1st. If you're waiting on a new experience, it might be best to go ahead and wait a little bit longer. But if you're ready to submit and that's the only thing, then go ahead and do so. So patient care experience. So CASPA defines defines patient care experiences as experiences in which you are directly responsible for a patient's care. So we're looking for hands-on, we're looking for performing procedures, counseling patients about their illness and treatment plan, and participating in clinical decision-making. So I have a note here that unpaid experiences are less likely to fall into this category just because paid experiences tend to have more responsibility. But again, that's not always the case. So it's less likely, but not always the case. So we have a long list of examples of positions that tend to fall in direct patient care. But again, just because you put down that you're a phlebotomist, if you don't tell us in your duties what you're doing and that you're performing phlebotomy and procedures on patients, then we can't categorize that as patient care experience. So it's not about the title. Please put the title, but please tell us what you're doing. The second category is healthcare experience, and this is another common one, and we also value this. It doesn't get rewarded as much as the patient care, but we look at it and we definitely appreciate it when we're looking at an application. So CASPA gives a definition that you can see here in the guidebook, but we like to make a couple clarifications about this specifically to our program. So make sure you're scrolling along with me if my screen isn't scrolling. So our distinctions. Experiences providing supportive care only are generally not rewarded as healthcare experience or patient care. So sometimes we see this with CNAs working in a nursing home and all they're being allowed to do is feed and bathe patients. So if that's you, you might want to start looking at some hospital systems or maybe another facility that allows you to do a little bit more direct hands-on patient care, because that's what we're looking for. If you do something like that as a volunteer experience, we of course value that as volunteer experience. The second point to make is that some of the positions noted in the CASPA definition, like CNA or medical assistant, we notice that those often acquire actual patient care hours. So we know that a lot of CNAs and medical assistants are making clinical decisions, are doing procedures on patients, are taking vitals and making decisions about those kinds of things. So tell us your duties, and we're not necessarily following the CASPA definition there. When it comes to clerical work, we're looking at something like a medical or office secretary where direct interaction with clinicians and patients is described in your duties. Here are a couple of examples of healthcare professions that typically fall into the healthcare or health-related experience category. Probably the one that's most common that we get in the program is a scribe. We know we have a lot of scribes working in the ED, so we certainly, a lot of scribes get into the program, so it's one of the major positions that we see. But I also noticed that some scribes are doing more than just scribing. So put that in your duties. If you're scribing, but you're also doing some sort of direct patient interaction or making some sort of decisions, let us know, because all scribes are not alike. And lastly, a few situations that preclude experiences from being rewarded as patient care or healthcare. These are probably the most important to know so that you're not wasting your time and that you're getting a position that's going to be most beneficial to preparing you to be a PA. So I already mentioned that supportive care only is not counted unless it's a volunteer experience. It's not counted for patient care. Experiences outside the U.S. healthcare system. So we're looking for your healthcare experience and patient care experience to be within the U.S. healthcare system, because that will prepare you best for how you'll practice as a PA. That does not mean that volunteer experiences like going and doing a mission trip outside of the country is not going to be counted. It just won't be counted as healthcare experience. For academic credit, so if you do something like an internship or something where you're getting credit for, we can't count that as healthcare experience. That doesn't involve any direct responsibility because you're getting credit for it, so we don't count those, although they can be very valuable in your learning experience. Shadowing and observational experiences, those are great to do if you have no experience with PAs, and we don't want you to come to PA school never having shadowed a PA if you haven't had the opportunity, but we don't count shadowing experiences as healthcare. And the very last is veterinary and animal care experience, unfortunately does not count, although we love to see it because we love animals. Licenses and certifications, I'm not really going to talk about this because it's not in the category, but if you secure one of these licenses or certifications, you're much more likely to be able to get direct patient care. So I would definitely look into some of these and read through the guidebook for these if you don't have one. And so I think GPAs was number 2. Jane, am I correct about that?
I think we should ask Aaron because I've been in the chat world.
Oh, in the chat world. That's okay. I wrote down. Oh, no.
It was prerequisites.
Yep. So Jane, you're up for prerequisites then.
All right. I'm on it as soon as my video works. There it is. Hello. Let's talk about your prereq questions. Hopefully y'all got a lot of questions answered about PCE and HCE. Remember, like Professor Morris said, or like Shannon said, it's very much based on the duties. And so we want you all doing things that are close to what you'll do as a PA. So hands-on care and especially decision-making and patient care are going to be helpful. It's all about the duties, guys. All about the duties. So make sure you write those in clearly in your CASPA application. In terms of prerequisite experience, I have to get to the guidebook and prerequisite experience, prerequisite courses. Here we go. So our I'll start up here because there are some questions in the chat earlier about some of these things. Our general rule, there are 8 prerequisite courses. They all have to be 3 semester credits or 5 quarter credits and completed at a U.S. institution with a grade of B- or better. Keep in mind, the higher this score is, the better off you are. And so for lab courses, lab and lecture courses will be averaged to obtain the course GPA. Both of those must meet the minimum grade requirement, so a B- for both of them. There are 5 prereqs that need to be completed within 10 years of your application. And all of those prereqs need to be completed prior to March 1st for your application to be considered. A copy of your transcript can be sent, and that can be sent by July 1. So online courses, there are some questions about that. We don't recommend taking online courses for lab courses, especially if it's the first time you've been through that material. Sometimes just making yourself go to the campus and get involved on that level will give you a better handle on the material. That said, I know we are in the middle of a pandemic, so if you cannot get to an on-campus class for those labs, it's fine. We don't require it. If online was the only option, that's okay. All right, so just make sure you're taking the courses, you're getting as much knowledge as you can out of those, and you are getting those scores in the timeline that you wanted to have done. Okay, so in terms of survey courses, we don't accept survey courses, and I'll show you on the next page what those look like. We don't do that because we're trying to be pains in the rear, guys. We do it because we want you to be prepared for the curriculum once you get here. And so courses that cover multiple disciplines, like multiple of our chemistry or OChem or biochem especially, is common. Just don't get in as much depth of that material as necessary to give you a strong foundation for achieving what you need to achieve once you're in the program. And so we ask that you avoid survey courses. In terms of AP courses, I saw a question about AP courses and whether those would count. We also know that during COVID, there were some institutions that were giving pass-fail grades instead of letter grades to courses. So all of that's fine. Whether you have a CLEP exam that's allowed you to test out of a course and get credit for previous learning or credit by exam situation, whether you have an AP course or whether you have a pass-fail course, those are allowed, but only 2 of your prerequisites can be accepted with those kinds of scores without a traditional letter grade. So only 2 prerequisites are accepted without a traditional letter grade. So pick and choose which ones you are thinking of submitting with a non-letter grade. And in terms of grade substitutions, we don't substitute a ton, but there are a couple of prerequisites where you can take 2 courses to achieve them. So general chemistry is probably the most common one. So there's usually a general chemistry 1 and a general chemistry 2 taken. So say you took general chemistry 1 in your freshman year, your first semester in college, and you just didn't have your act together yet, and you got a C, that's okay, because when you took general chemistry 2 in your second semester, you got an A. You knew how to study, you had your feet under you, and so that general chemistry 2 with the A is the one that will count. All right, so you can substitute where there are doubles for courses. Another example would be in math, physics, or college statistics. The CLEP exam is not taken through EVMS. That's a different system because you would have to get credit for that through your own undergrad institution or other community college institution if they offer that. So for college math, statistics, or physics, if you got an A in math, a B in physics, and a C in statistics, because you took all three, we would count the A that you got in college math. And so for anatomy and physiology, we want you to take anatomy and physiology or A&P1 and A&P2. And we do this for the same reason that we don't kind of go into accepting survey courses. So if you take anatomy and then you take A&P2, you have the potential to have missed the P1 part. So you haven't got the full breadth of physiology. And we want you to have that. So you have a good foundation when you come into the program. So make sure that you're taking A&P1 or A&P1 and A&P2 or anatomy and physiology, preferably at the same institution, but you don't have to do that. For organic chemistry or biochemistry, if you've taken both of these, we'll count the score that's higher. Keep in mind you can't survey these. You can't have a survey of both and have it count. And the same thought process applies for micro or cell biology. Your advanced psychology course, it can be anything beyond an introductory psych course. Abnormal, lifespan, or developmental are recommended, but they're not required. It can be anything that isn't a psych course as long as it's offered from within the psych department. We say that because the psych department courses tend to be in more depth and they prepare you better. So if the tag for your course says like socio or anthropology or something because it's been delivered in a different department, it may not count for your, it won't count for your advanced psychology course. So make sure you're taking that advanced psych course from the psych department, and keep in mind that part 2 of intro to psych does not count. These ones need to be these science courses here, anatomy, or your chemistries, your biologies, and your advanced psych course need to be completed within 10 years of your application. And we ask that because we want you to have the most up-to-date information as your foundation for PA school. And so we do make advances in sciences, and we want to make sure that you've learned what's the most advanced. Brianna, we don't have a preference for advanced psychology. These are recommended. The abnormal, lifespan, and developmental are recommended. As long as it's something beyond intro to psych 1 or 2, it's fine. So for specific questions, I would encourage you to put those in your Pearl. These ones you need to be completed within 10 years because we want you up to date on your knowledge and education. These intro to psych, general chemistry, and then the college math, physics, or statistics can be taken anytime. They don't time out. There is a waiver of a 10-year window for 2 prerequisites in the 10-year window. There are only a couple of ways to meet that waiver. You have to have taught the topic as a professor for several years, or you have to have worked in the fields of chemistry, physics, or psychology for the last several years within the last 10 years. We do ask for a CV, we ask for letters of reference, we ask for contact information for your letters of reference, and we call them and verify everything to make sure that you are prepared for the rigor of the curriculum that you're going to encounter once you're in the program. There are 46 messages in my chat. So if I've missed anything, hopefully I've answered some of your questions. If not, please send us a message through your Pearl.
Yeah, I was going to say pop quiz. Where do we go for questions and answers? I wish we could get to all of these. Some of them are very personal. Some of them, I think if you read the guidebook, might be clarified. Some of them maybe not, but we're happy to follow up with you guys. It is 11 o'clock, past 11 o'clock. So we were going to offer, we can go until 11:15, which is really only 4 minutes now, if you guys want to hear about the third topic of GPAs. I don't know that, Erin, was there anything in the chat that was overtaking some of these other topics?
No, it's all been about these topics.
Oh, so we guessed the topics well. We might not get to all of them, but we have a couple more minutes if you guys want. If you want a few more minutes with us to discuss GPAs, we can take a little extra time, or we can pass it to the students and you guys can do kind of your own digging and message us through your Pearl. So Erin's going to put up a poll. Let us know if you want a few more minutes with us or if you want us to pass you to student Q&A. And Ebony says, where do you go to send a message through your Pearl? Ebony, if you have a Pearl set up, when you go to it, you should be able to see a little box that says submit a question. Oh my gosh, we're on a split. You guys don't have to make us feel better. We're not going to be offended.
Keep in mind, we're not going to disappear. We'll still be around. So if you want to ask the students questions now, that's fine, and we'll be here if there's something specific that we can answer.
Maybe some people don't have strong feelings either way. They're just happy to be here. Me too. All right, well, it looks like the students are winning out. So I'm going to pass the torch over to Elizabeth and Amanda. Again, we will still be here if questions come up that we can answer. We will certainly pop in, but I'm going to let them turn on their cameras and have a chat with you guys.
Okay, hello everybody. We're just going to reintroduce ourselves real quick just so you remember who we are. I'm Elizabeth. I started the program in January of 2019, so I've completed 2 full years of school at this point. I'm in my 3rd year, which means I'm right in the middle of the clinical rotations that Dr. Dempsey was speaking about earlier. We've completed 5 out of the 9 at this point. I am an out-of-state student. I know a lot of times people have questions about that. I moved here from Baltimore, Maryland. And I do really like Norfolk, so we can get into some questions about that. And we thought it would be cool to just tell you a little bit about what it's like to be a student in the 2 different phases of the education that you get here. So in the clinical year, you're actually very much acting as if you're already a PA. We have the 9 different specialties. You spend about a month in each specialty, and you are working with a preceptor who is either a PA, a nurse practitioner, a doctor. They take you through, and you work with them full time. You go to work with them every day, and some of their schedules are different. So, you know, if you're working in the ER, you might actually be working overnight and on the weekends and on the holidays. But if you're working in an outpatient clinic, you might just be working 9 to 5 every day. But they basically let you do everything that a PA would be doing. You get to see patients. You get to discuss what's going on with that patient, what you would order for them as far as testing goes, what treatments you might offer. So you're really testing your knowledge that you learned in the classroom. And then, as Dr. Dempsey mentioned earlier, at the end of every rotation, you do have an end of rotation exam. And that is just there to make sure that you are learning all of the knowledge that you're going to be tested on for the board exam at the end of, like, after you graduate, so that you keep up with the knowledge as you're going through the clinical year. So really, it's just going to work every day and seeing patients and you know, bettering your medical knowledge for an entire year. It's really fun. So Amanda, would you like to say hi?
Yeah, sure. Hello, everyone. My name is Amanda Myrick, if you forgot, and I'm just about to finish up my 1st year of PA school, which is wild. It's been an interesting year, but yeah, I'm really excited to be here, and I'm going to tell you a little bit about what it's like to be a didactic student. This is our really classroom-heavy 16 months, and I have kind of a pre-COVID life and a post-COVID life of school, so I'll tell you a little bit about both of those looks. I hope when you come to school that COVID will not be a thing anymore, so you'll have more of a traditional education. But in January through March, that's a really classroom-heavy semester. We're in lectures mostly all day from about 10 to 5, depending on lab days, and we do all of our core lectures in person and then go to various labs. The big one first semester was anatomy lab. We went there 2 or 3 times a week, and dissected all the cadavers ourselves and really got to be hands-on with the anatomy there. And that was really a cool experience. They have probably like 20 or so people, be it TAs or other professors in there helping us, and it was a very interactive way of learning. Post-COVID life is a little bit different. Instead of going into lectures in person, I log into a Blackboard Collaborate room just like this usually, and we do online lectures. We're going to probably go into COVID quite a bit if you all are interested, but it's actually been a very good experience for us. I know we have lots of different students. A lot of them are parents, so it's been very helpful for people with kids to get to spend more time with kids. People that were out of state got to spend more time with loved ones, etc. But now a normal day just looks like logging in on my computer and taking classes for a few hours, studying a lot. I see a study question right there from Erica, so I'll get to that. Studying a lot, and they've actually this semester done a very, very good job of getting us onto campus quite a bit. We're probably on campus 2 to 3 days a week now, whether it be for ultrasound lab, which is awesome, and we can talk more about ultrasound lab. We just had our big final in that class this past week. So, or in the CECL, which is with our standardized patients, and we get to interact with them and perform. This semester we're focusing on physical exams. Last semester we focused on history taking. So being a PA student is fun. Yes, Professor Penny loves CECL. She's our instructor for that course along with some other professors. Being a PA student is fun. It's a hard program. It's a very rewarding program, and it goes by very, very fast. I saw some questions from the last chat that we are going to talk about first, and then we'll open up the room for any questions. Erica, I'll just answer your question real quick. How have your study habits changed since starting at PA school? Are there any tools you recommend? So this is so student dependent. I know I live with 4 other students, and we've all had to adjust and do very different things. For me, I was never a group studier, but now I have one other classmate that I really study with every day, in and out. And that's really helped me. But my biggest advice would be don't try to change everything. I think we all fell into that because you heard so many different advices, and people are saying, you know, use your iPad or use hand notes. You just have to do what works for you and don't go and try to change everything. Elizabeth, do you want to go ahead and talk about someone asked about community outreach programs in the last chat?
Sure. So EVMS is very community oriented. I saw the question too. It asked if there's any community outreach programs and what type of activities that students get to be involved in that aspect. One of EVMS's main missions is to be the most community oriented medical school. And because of that, we are very involved. One of the things that we help run, it's called the Hopes Clinic. We kind of alluded to it earlier. It is a free clinic for the community that students basically are the providers for. So we do this in conjunction with the med students as well. And we do have physician mentors that are there with us, but it is basically a free clinic, kind of like an urgent care clinic that people from the community can come and be seen for free, and we help do their healthcare there. That gives us a lot of experience, you know, before we graduate in how to be a provider and take care of patients. So that's a great opportunity. We also have a service learning initiative that our classes participate in, where we all join a group that EVMS kind of oversees. And there are I don't have enough time to go through all the different groups, but for example, the group that I am a member of, it's called Bystander CPR. So basically we go out into the community and we teach people CPR, how to do the basics of it so that you could help somebody in need in the time it takes the emergency responders to show up. And then also there are other like health screenings that we can participate in and things like that as well. So we're very community oriented. The only problem is right now with COVID, it's a little bit different. Some of the things that I'm doing for my group is virtual. We're doing things like, you know, looking for AEDs in the community and things like that. So we have adapted, but there is a lot of opportunity for that. And then, Amanda, did you have anything to add? Or I was going to start talking about COVID because I've seen a lot of questions about how it's changed our education. So I was going to jump into that.
I think that's a good big topic to talk about.
Okay. So I will talk about the portion of the clinical year that was affected by COVID. My class was finishing up our didactic year when it first started. So we were getting ready to start clinical rotations in June this past summer. And that is when basically the whole world was, shifting the way that they do things. We had to adapt and make changes. And so we did have a little bit of a delay before we went out into the community. And that was based on, what the governor's regulations were, as well as what EVMS was doing to keep their students safe. So we had a 2-month delay. And in that time, our teachers jumped through lots of hoops. They did a great job making sure that we were still getting an education in that time. We actually did some online learning. It's basically this online clinic platform where you can see virtual patients and you can learn from those cases. You can answer some questions, tell the system what you would have done if you were seeing this patient in real life, and then they would give you feedback on what you would do. And it was a really nice intro to each one of the rotations because we spent a week with each one of the rotation topics. And so we had that 2-month delay. And then once we got out into clinical rotations, our preceptors are aware that we are not supposed to go into any rooms where a patient has been diagnosed with COVID or they are COVID suspected. But there are still times, for example, in the ER where you just don't know if the patient has COVID or not. Sometimes, the patient is unable to relay what they're feeling. So our preceptors have done a tremendous job keeping us safe. I was in the pediatric ER, which you guys can guess, there's a lot of little kiddos coming in that can't really tell you how they're feeling. And so my preceptor said, she's like, I'm going to keep you safe. Here's the PPE, put it on. I'm not going to send you in any room that I suspect anything bad's going to happen. And, we got through it. So for the most part, I feel very protected by my preceptors. They are looking out for us. And then also EVMS has been providing PPE for us to go into the clinics. They've been giving us N95s when we need it, masks when we need it, and things like that. So as far as I know, none of my classmates have gotten COVID while on rotations, but maybe somebody else could answer that question better. I haven't heard of anybody, so we're pretty safe. Amanda, how's it going in didactic with COVID?
Yeah, I touched onto it a little bit earlier, but every semester we're all getting better at this, and by the time it's over, we're going to be experts at online learning in school. But it's been really honestly good. The admission, our professors have done a great job of adapting. It was hard at first. We were in the middle of anatomy lab, and our awesome course director at that point somehow managed to set a live stream into the cadaver lab and let us virtually finish the dissections. And it just goes to show how much the faculty is willing to help us out in these times of need. Last semester, we did all of our history taking with the Cecil patients online, and that actually worked out perfectly. We were able to do a history where you don't actually have to touch anyone online, which will prepare us in the end of the day for some telemedicine visits. And I know we're all seeing that more and more in the real world. And then this semester, we pushed all of our ultrasound that we normally would do gradually over from first semester through fourth semester of didactic. We pushed it all to this semester, which I thought was going to be very intimidating, but it's actually been very nice. We're getting to interact with the ultrasound probes on our teams. We're assigned to teams of two to three people each, and we just all always do ultrasound on each other and are in the same interactive groups. So we are limiting exposures in that way. We're getting to go into ultrasound 2 to 3 times a week, which for the exposures to the ultrasound being so close together, I feel like we're all getting becoming more proficient in ultrasound quicker than we normally would if it was spread out over all the semesters. So overall, it's been a really good experience. While we're in the Cecil is one more thing that's a little bit different. All the patients have full-on PPE. That's gloves, mask, goggles, or a face shield. And so do we. So there's a few exam things, be it eye exam and mouth exam, that we've had to modify just to limit any exposures, mostly for the standardized patients to keep them safe since they're still seeing medical students and us. But overall, we've still gotten to interact with these patients just as we would in pre-COVID life. So that is COVID adaptations. I know there's lots of questions. Yep, go ahead.
So Amanda, I actually wanted to talk about, Emily asked in the chat, she said, how do they prepare you for clinicals? Like, what are some of the tools that EVMS uses? And I think we should go a little bit more into the CECL. So we call it CECL. That stands for Centera Center for Simulation and Immersive Learning. I think this is a very unique opportunity that EVMS provides for their PA students. One of the reasons that I chose EVMS, that I really like it, is that it is integrated with a medical school. So we do get to use these resources that I don't think a lot of other PA schools may have access to. And so basically what the CECL is a simulation environment. There are patients that we go see, but actually they are actors. And our teachers spend a lot of time training these actors, making sure that they are consistent across the board. But every single one of our classmates goes to see this patient. It's as if you have a patient on your schedule. And for each, it's kind of broken down by body part, and there's lots of different activities, but it's a very real environment. It feels like you're a provider. There are cameras watching for grading purposes, and you do get to watch some recordings of yourself if you'd like to learn. And I think it's just a wonderful opportunity for you to see how you are as a provider. The quote unquote actors give you lots of feedback. They are very well trained. They've been doing this for a long time, so they've seen lots of med students, lots of PAs, and they can give you feedback and let you know what you can do to speak, phrase things better. They'll like point out little, habits that you might do that you didn't realize you were doing, like if you have a nervous tick or something like that. And it can be uncomfortable at first when you start. It's a lot, it's overwhelming, but that's part of learning. And by the end of it, by the time we get to the end of didactic, you feel very confident in your skills, and then you just go out into the real world and do the same thing. So that is a huge plus in how they prepare us to get out to the real world. And then, as Amanda mentioned earlier, we also have lots of training programs that we learn over the course of our didactic year, like ultrasound. We have a skills lab that teaches you how to do blood draws, how to put in catheters, how to read EKGs, how to suture skin. We have lots of models and lots of different lectures that basically walk you through the course of the procedures that you'd be doing out in the real world. So they have designed our curriculum in a very specific way. They always ask for feedback, and they adapt and change it every year so that it's always better for what we need when we get out into the real world. And everybody that I know in my class, as well as lots of people who have come before me, have always said that they feel very prepared when they get out into the real world. So they do a really good job of preparing you.
Elizabeth, a lot of people have asked about us getting to PA school, and the one thing I wanted to say about that is everyone, all of my classmates, I'm pretty close to a lot of them now, have extremely different backgrounds. My experience doesn't compare to someone else's experience. My undergrad doesn't compare to other people's undergrad, and our age range is from 21 to 46, I think, in our class. Some people are parents with 4 kids. Other people just got out of college and came straight here. So I know, and I remember being in your shoes, like, I was a scribe. So, everyone that's a scribe always worries about, is my experience good enough compared to other people's? And that is totally valid. But PA school is awesome. There's lots of different paths to it. It's not so cut and dry like other programs. And just sit back and be comforting about, have some comfort in the fact that lots of different people have different paths to get here.
Yeah, and to add to what Amanda said, I agree with her. Everybody's different. I was one, since you guys are asking, I was one that did a career change. I was actually a research coordinator, did a lot of prostate cancer research before I came to PA school. And so I was out in the real world for about 10 years before I came back to school. But as Amanda said, there's some people who came right out of undergrad. So really it's not, about your specifics. It's about your motivation and your, how good you would be as a PA. I just saw a question. Somebody asked, Elizabeth, are you feeling prepared to take the PANCE and apply and enter into the workforce. So the question is absolutely. As I mentioned earlier, with the rotations, there are 9 of them. 7 of them are like the main core subjects of medicine that you need to know a lot about, and then 2 of them are electives. And at at the end of every rotation, we take that end of rotation exam that I told you about. So it's kind of like a stepwise learning where we're going over everything that we went through in didactic again in clinical year, but then the tests along the way make sure that you're just keeping up with the material. And then there are lots of other resources that the school provides. One of the things that they give us access to is something called Rosh Review. It's a bunch of practice questions to help you get through it. We have something called Kaplan videos, which are basically little mini lectures to re-go over the subject to make sure that you know it. So in addition to, it's kind of like you go through the subject so many times that you get very familiar with them. You go through it in didactic, then you go through it again in clinical, you get tested on it in clinical, you have lots of resources to get your knowledge going and all those practice questions flowing. And then by the time you graduate, you're ready to take that test. And then I believe it was Professor Morris that mentioned it earlier. We also have a practice PANTS test that they give us. We take every single one of our tests in the testing center. So they actually create the environment that's going to be very similar to test day. When you take your board exam, you're not used to, you're not taking it at home with your own computer every day or in the classroom. You're actually in a testing center, which is what you're going to do when you take your board exam. And there are proctors there. It is very simulated to be like the real day. So that's just the long-winded answer of saying, yes, I feel very prepared to take the PANTS. I still have 4 rotations left before I have to, but they definitely design it so that you're well on your way to do well when you graduate. All right. Is there another question?
Yeah, there was a question. There's a question earlier in the chat from way before about lectures being textbook heavy or not. I can just talk a little bit about format of studying and learning. Most classes do have a textbook assigned, and you're supposed to do the reading before class, and that really does set you up to succeed. It's a good idea to know what you're getting into before the lecture starts. That being said, not every class has a lecture. Some get supplemental readings or research articles, or some is strictly just a PowerPoint and an attached video or an in-class activity. So they try to vary it, so we're not just reading a textbook or just reading, watching PowerPoints. But generally, my 2 biggest things that I use for studying is a book and the PowerPoint slides. And yeah, that's all I have to say about that, I think. And then team-based classes, ultrasound, medical diagnostics is a big team-based class, and anatomy lab, you're in a team for that setting. So there's lots of different varying ways to learn that we do in PA school. Did you find another question, Elizabeth?
Yeah, so we actually just had 3 questions in a row about how EVMS is assisting with our job search after graduating.
Okay.
Another benefit of EVMS is that because they are so, because they are so community oriented, we have a lot of alumni in the area, and when we're out on our rotations, it's actually like a little mini job interview. I know of several classmates or people from the class above me as well, where they were on their rotation, because you're working side by side with these people for 4 or 5 weeks, and they get to know, how you are, your medical knowledge, your motivation, and a lot of times people have gotten hired straight from the rotation. So that's a huge positive. We also are connected with our alumni, and my class in particular, we have a senior seminar coming up next week, and a lot of the alumni from the area have agreed to do mock interviews. So they're actually, we have an entire week that's prepared to help us launch out into the real world. It's going to teach us how to speak during an interview, how to negotiate a salary, how to talk about the benefits and the things that are important that we might not even know as students. So not only are they preparing you with the medical knowledge, but they're preparing us for our interviews as well. And then sometimes during those mock interviews, people have done so well that they could get a job from that as well. So there are a lot of connections to locally, but as far as you know, how they prepare you, I mean, they think about it on multiple aspects, and there's lots of opportunities for jobs. I don't know if Professor Morris or Dr. Dempsey have any other things to add to that part, but I don't think our students generally have a hard time finding jobs.
No, I added in the chat that we typically have a School of Health Professions job fair each year where major employers come and talk to students.
Yeah.
And so that may or may not be virtual, but we always make sure that we know that we reach out to our community partners and find out what jobs are open. We have the PA job board. Sorry, I was chatting, so I might not be answering the right question, so feel free to redirect me.
No, that's okay.
Is that helpful? Are they asking about looking for jobs?
Yeah, how EVMS helps us find jobs.
Yeah, so we have the EVMS job board, and we ask people to post on that around the time that our applicants are graduating. We reach out to recruiters. We have certain residency programs, the EPT emergency medicine and the CHKD urgent care. They will come and talk to students either virtually or in person and try to get them into those programs. And so we do everything we can locally to help. Not as much that we can do for people going out of the area, but I think what a lot of people do is they do their rotations back home, and that helps them make their connections, and a lot of them get job offers on those away rotations.
All right, Elizabeth, I was going to talk about, someone asked, are you assigned a mentor, or should I say a PA big, or are we assigned a faculty mentor? So Elizabeth and I are actually both involved in the mentorship committee, and that means that we help set up mentors for the PA class. We've changed it a little bit, and now we're doing group mentoring. So not only do you have one PA big, but you have a group of 5 to 6 upperclassmen. So we're about to get our mentees for the class of 2023. And that just is a student mentor for you to relay any questions, any concerns, any night before the test questions of how do I do this? What am I doing? That is there for you. So you'll have a student assigned to you as well as a faculty advisor. And they're there for you. They check up on you every semester. You have meetings with them every now and then, and they are an email away at all times, and that's a really good resource if you're struggling with anything personally, academically, just need someone to throw some ideas around with, or just talk to a faculty member. So 2 big opportunities. And there's another question about clubs and organizations. So the biggest one that we're involved in is mentorship, but there's lots of different clubs and organizations. I know some of my classmates really are involved in medical Spanish and are learning quite a bit more through that program. Elizabeth, do you want to talk about any other clubs or organizations?
Yeah, so the Medical Spanish Club, just to add to that, they actually practice being medical translators as well, and they can go out to the health clinics and help patients, understand what's going on. There are lots of clubs beyond what I mentioned earlier, because we do work with the clubs in conjunction with the rest of the schools, so it's not just PA clubs, it's everybody. And I mean, there are clubs for everything. There is the Phoenix Committee, which is a group of students that basically are there for other students. And what I mean by that is they make sure you're doing okay, if you are stressed out, if you are going through something really tough in your didactic year. There are people that you can talk to, and they'll help you get through it. There's like an a cappella group. What else is there?
There's a brand new one this year, PA Students for Inclusion and Diversity, that a few of my classmates are working on, which seems awesome.
So, like I said earlier, the list is really long, but it's open for PA students, and there's a lot of opportunities to get involved. So it's definitely there for you if you'd like to be a member of some groups. I think there was another question. Oh, it might have been answered, but Mark asked if EVMS has connections to rotations all over Virginia. So Professor Morris did kind of hint at that, but yes, they do. They have a long list of rotations where they already have connections set up, and then also you are able to go and set up your own rotations as well. So it's local. I see she's unmuting.
Yeah, I'm happy to talk about Virginia rotations. I also work in the clinical year, so that's why I keep chiming in for that. Most of our rotations that we provide are local in the Hampton Roads area, but we've also reached out into Richmond near VCU, and then we're up in the Northern Virginia, Nova area around Kaiser Permanente. So in those situations, we actually do provide housing. So if you're a student who doesn't live up there, we give preference to students who do live up there. And so if you want those rotations and you have housing, then that's great. We have some things you can start with, and then you can build around it with your own connections. Otherwise, if you don't have housing and then just want the experience of going somewhere cool like Kaiser Permanente, then we have housing up there as well. So all over Virginia.
So we only have a few more minutes, and I just thought a really good question I think that we could probably wrap it up with. Erica asked what has been our favorite part of the process. So my favorite part, I think, has been self-reflecting and realizing how far I've come. When you start PA school, I mean, it is overwhelming. Everybody talks about the metaphor of it's drinking water through a fire hose. There's a lot of medical information you need to learn in a short amount of time. It can be stressful, it can be overwhelming, but like I've alluded to a couple times, UVMS has designed this program in a very specific way. It builds on itself and it gets you to the point of where you're going to be a good provider when you graduate. And so there was kind of there's kind of a flip where the whole first year you're kind of like, oh, I don't know what I'm doing. I'm kind of overwhelmed and I'm learning so much. But then there was a time where we were out in rotations and I kind of sat and looked back and said, wow, like, look at how far I've come. Look how far UVMS, how much they have taught me. And it's just really cool to realize, how far I've come in the program. So honestly, that's been my favorite part so far.
Yeah, Elizabeth, I was about to say something very similar. Growth, exponential growth. But myself personally, watching my roommates grow in this program, it's been really remarkable. Also, I've made my lifelong best friends here. And everyone, such a diverse group of friends. It's different than college where everyone's your same age and that's the same background. It's really unique and it's a special program. And we'd love to see some of y'all join it soon.
Yep.
All right, well, we'll pass it off to Professor Morris.
Thank you both for all of your answers to questions. We are wrapping up our session today. And so as a reminder to you all, make sure you check out the website and review information there, and be sure to connect to a Pearl at at justgo.evms.edu. There's a link in the chat right now.
I've been looking at the chat. My apologies for my lateness. You will receive a survey to the email that you registered for this event for later on this afternoon. Please, please, please fill it out so that we can see how we did. And there will be a section for you to ask any lingering questions there as well. As a reminder, please register for your Pearl, and you can ask specific questions through there. Not sure if we have a second for me to show what mine looks like real quick.
You can pull it up. I just wanted to remind everyone to make sure that you go back to the lobby. There is a student tour video there, and several of our students volunteered for that. I think Taylor and Eric are on there. So it's a really good, I watched it last night and it's great. And if we, for some reason, just get kicked out of here, it's 11:46 and I think we're okay. But if we get kicked out, then thank you so much for being here.
And I'm just waiting. Okay, this is an example of what your Pearl would look like. This is my Pearl, and it does say that I've been invited for an interview, but this is for testing purposes only. There's a section over here on the right saying, how may we help? That's where you would submit questions. If for some reason it is not there, please, we do not have access to change the settings on your pearls. Please email the admissions department for any other technical questions at hpadmissions@evms.edu.
All right, well, I guess that's a wrap. I know Kim wants to say goodbye, but she's talking to someone in the chat.
Oh, I did. Connection is weak, so thank you all for coming.
Also, there is a campus tour video available in the lobby right now. Please be sure to go check that out. Some of our PA students were also involved with that.
All right, thanks everybody.
Thank you all. Have a great day.
Boom.